Gluteus Maximus muscle. The gluteus maximus is the large muscle group that forms the buttocks. This muscle is twice as heavy as the gluteus minimus and the gluteus medius combined. It functions to prevent hip flexion after the heel strike phase of walking and is very active in bending at the waist and squatting motions. Here are the landmarks. We have the sacrum, the ilium, the femur, and the sacrotuberous ligament. The origin of the gluteus maximus is on the posterior bordum of the ilium, the sacrum, and the sacrotuberous ligament. And the insertion is on the gluteal tuberosity of the femur and also on the iliotibial band of the fascia lata via the aponeurotic sheet. Contraction of the gluteus maximus produces extension of the hip and lateral rotation of the hip. The hamstrings and posterior fibers of the gluteus medius are synergistic during extension, and the piriformis is synergistic during lateral rotation. The iliopsoas and rectus femoris oppose this muscle during extension, and the adductor magnus opposes the gluteus maximus during lateral rotation. The clinical findings for gluteus maximus trigger points. Dr. Travell refers to the gluteus maximus as the swimmer's nemesis muscle. Clients with trigger points here may complain of pain and tenderness in the gluteal region, especially while sitting, aching pain while walking uphill and/or in a bent forward position, and, as its nickname implies, cramping during swimming. Some activating factors for gluteus maximus trigger points include swimming, a fall or near fall, impact trauma, prolonged uphill walking while leaning forward, an intramuscular injection as with a flu shot or booster shot, sitting on a thick wallet, and true SI joint dysfunction. The gluteus medius, the gluteus minimus, and the hamstring trigger points are all functionally associated with gluteus maximus trigger points. Clients with active gluteus maximus trigger points are commonly misdiagnosed with sciatica, SI joint dysfunction, and trochanteric bursitis.